Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. Hi, everyone. It's Dr. Mehra, founder of Endo Kids Concierge and your host for the Endo Kids Podcast. I'm here with Dr. Waldman today, and we are going to talk about the thyroid.
Hi, Dr. Mehra. How are you doing today?
Good. How are you?
Good. And as Dr. Mehra said, I'm her hormone sidekick for today's discussion. And we're diving into a topic that is Googled more than most other topics in pediatric endocrinology, the thyroid, and particularly hypothyroidism in pediatrics.
Yeah, so today we're going to cover myths about the thyroid. We're going to talk about the lab results, really what the thyroid is and what it does in kids. And we get a lot of questions and a lot of conditions are blamed on the thyroid. So we want to dispel some of those myths.
That's right. So why don't we start with what exactly does the thyroid do?
Yeah, I usually start off by telling my patients that the thyroid is a small gland that sits at the base of your neck. So it's a butterfly-shaped organ. It sits on your neck, and really it's like the gas pedal of the body. So it is responsible for so many things. It's responsible for growth and metabolism and energy, temperature, heart rate. All of these things are controlled by the thyroid. In addition, digestion and brain development. So all of those things are controlled by the thyroid. And we really rely on the thyroid for so many things.
Absolutely. Kids rely on the thyroid even more than adults, if you can believe that. And when thyroid levels run low, growth can slow, and parents sometimes can miss some of these symptoms because they can have a very slow onset. It's very gradual.
Yeah. And kids rarely tell you that they're tired. Sometimes they may have trouble waking up. They may lose interest in activities. They may seem mentally foggy. One of the most common things we see, though, is poor growth in kids.
Of course. And we've talked about the growth chart in some of our other podcast episodes. And we always say the growth chart is probably one of the most important things that your pediatrician and certainly your pediatric endocrinologist can use in assessing everything about your child. So when you go to those yearly checkups and you have your kids get measured, looking at the growth chart along with your pediatrician is really important because some deviations from what they were normally growing at can potentially signal a problem with the thyroid.
Yes. And pediatricians actually are looking closely at your child's growth chart also, just to look to see if there are hormone deficiencies. So we'll talk a little bit more about some of these other hormone deficiencies, but the thyroid is one that gets blamed for a lot of different things. What we're going to talk about first, though, are causes of hypothyroidism. So what causes the thyroid to not function? And in later episodes, we're going to talk about hyperthyroidism or overactive thyroid. But this episode, we're going to specifically focus on underactive thyroid. One of the most common causes of underactive thyroid, low levels of thyroid hormone, is a condition called Hashimoto's thyroiditis. So a lot of parents are confused about the term Hashimoto's. And that really just means that the thyroid is not producing enough hormone. It's usually associated with a family history. So somebody in the family has hypothyroidism. It can be associated with other autoimmune diseases like type 1 diabetes or celiac disease or other autoimmune conditions. And usually it means that there are thyroid antibodies that are causing the thyroid gland to not function. Dr. Waldman, do you want to talk a little bit more about that?
Sure. So, as we had talked about in one of our first episodes when we talked about hormones, antibodies are also things that can travel around the body and can cause some of our organs to not work as well as they should. I like to say that autoimmune conditions are a big question mark that we have. What causes autoimmune conditions? How can we prevent them? It is a really hard thing to answer for many of our patients, but we certainly know in endocrinology, there are a lot of autoimmune conditions that can affect children. And Hashimoto's thyroiditis is one of those. So you can have antibodies floating around your body that attack the thyroid. That being said, just because you have those antibodies doesn't mean that the thyroid is not functioning. And that's a really important point that as endocrinologists, we talk about a lot with our patients. So if you happen to have lab work done, and we'll talk more about what those labs are, you find out that you, your child, a family member, a friend, etc., has these positive thyroid antibodies. It doesn't necessarily mean that there's a problem with the thyroid, but it means there can be a problem with the thyroid. Is that how you explain it, Dr. Mehra?
Yeah. So usually I like to say that we all have antibodies that we make to viruses, right? So if you get a cold or you have the flu, your body makes antibodies, and antibodies fight that flu or that virus that you have. In autoimmune conditions like hypothyroidism, the body thinks that your thyroid is abnormal and it will make antibodies to fight that thyroid. And oftentimes it will go and start attacking the thyroid. And the result is that your thyroid gland can make less hormone over time. Okay. But the presence of those antibodies, meaning you have positive antibodies, or your child, you went to the pediatrician's office and they drew thyroid labs and antibodies, and the antibodies are positive. That doesn't necessarily mean that your child needs treatment. It just means that they may develop hypothyroidism in the future. Okay. Sometimes it'll happen in the next year. Sometimes it can happen in 20 years. So, really important to understand that point that these antibodies are signals that your child may develop an autoimmune condition that will lead to low levels of thyroid hormone, but they may not necessarily have it right now. Does that make sense?
Absolutely. And when we talk about thyroid hormone, yes, we talked about the gland at the base of the neck, shaped like a butterfly. That is what produces thyroid hormone. But it actually all starts in the brain, right? The pituitary gland, the master of all hormones, makes a particular hormone called TSH, or thyroid stimulating hormone. And that tells the glands in the neck, your thyroid, to produce enough hormone. So they work together in what we call a feedback loop. They talk to each other. If your brain, your pituitary is making TSH, it's telling the thyroid to work. If your brain, sometimes your brain is telling it to make a lot and it's not working. Sometimes your brain is not telling it to make any thyroid hormone. And those are the different ways we interpret the labs, the different things we look into if we see that a patient comes in with abnormal numbers.
Exactly. We'll talk about the labs a little bit more, but oftentimes patients will notice some symptoms before their thyroid labs are really abnormal. And so I think it's important to just recognize that what are those symptoms that children have? And to be honest, a lot of times it's very subtle. So you could see poor growth, just a little bit difficulty waking up in the morning. Sometimes there can be some weight gain, okay? But weight gain is not always related to the thyroid, but sometimes there can be weight gain, constipation, there can be dry skin or dry nails. Sometimes I've seen kids who just have some hair falling out and they don't make much of it. They think it's normal or they're stressed, but some of those subtle signs can be related to hypothyroidism.
Absolutely. All of those symptoms are really important to watch for. And like you said, they're really vague, right? So not all weight gain is related to the thyroid, not all hair loss is related to the thyroid, but they certainly can be. And whenever is more than one symptom, and we've said before, parents know their children best, that's when you need to ask the question, is there something else going on? Asking for potentially checking some of that blood work to make sure.
Exactly. And the Hashimoto's condition really is something that we see in kids who are a little bit older. So we don't see that in newborns. We see that in children, typically the teenage years or times when kids are going through rapid growth spurts. I have seen it in younger kids, but usually I see it in kids above the age of 10. And we also see it come on in women who get pregnant. A lot of times it's because of those hormonal shifts. But Hashimoto's usually is autoimmune. We see it in a little bit older kids and usually related to antibodies against the thyroid. The other causes are congenital. So if we see hypothyroidism in babies, we talk about congenital hypothyroidism. And Dr. Waldman, do you want to talk about that a little bit?
Sure. When we think about hormone issues, we don't necessarily think about babies having them. A lot of our minds go straight to those teenagers. But yes, like you said, even babies can have congenital hypothyroidism. And basically, what that means is they're just born with their thyroid not working properly. Maybe it wasn't formed properly, or there are lots of different steps in making thyroid hormone. It's a really complicated process, and there can be a problem in any of those steps. So we are really lucky living in the United States and that there is the newborn screen. So every baby gets what we call a newborn screen. The blood is tested for a number of different diseases and conditions, and congenital hypothyroidism is one of those. And so if you have a baby in the United States, they were very likely tested for congenital hypothyroidism. And sometimes you will get a call back from your pediatrician asking for more blood work. And we are really lucky that we can treat it. It is absolutely a very treatable condition. Babies just need thyroid hormone and they go on to live wonderful, fabulous, productive lives.
Exactly. And before the newborn screening was initiated, babies had a lot of problems because the thyroid is very important in brain development. And that's why we as pediatric endocrinologists get involved with babies who have an abnormal newborn screen because we really want to treat early and treat fast to get these thyroid levels in the normal range to prevent any issues with their brain development or growth. If you have your baby and they're screened in the newborn period, and you get a call back saying the thyroid levels are abnormal, oftentimes we will repeat the labs a few times, but we would like these babies to be treated as fast as possible. And the treatment is very safe and very effective for congenital hypothyroidism. Like Dr. Waldman said, these babies are often born either without a thyroid or their thyroid gland is not functioning or it just did not migrate or move from the base of the tongue where it's initially formed down to the neck. And those babies usually require lifelong thyroid hormone treatment. And they do just fine. They do great. That's one of the other causes for hypothyroidism. A third cause of hypothyroidism is, like Dr. Waldman said a few moments ago, where the thyroid hormone itself is given a signal by the brain to make hormone. And so if the pituitary, that area of the brain that is the house of all the hormones, is not working, so at the center of the brain, that we have a condition called primary hypothyroidism, pituitary-related hypothyroidism, where the pituitary is not actually sending the right signal to the thyroid.
Absolutely. And there can be some other much more rare causes of problems with the thyroid. Certainly, we can have medications that can affect thyroid hormone. You can have iodine deficiency, which is very rare, especially here in the United States. And there can be some other genetic conditions that are associated with thyroid problems. Again, these are much, much more rare, but certainly can happen. And the last thing that can happen with thyroid is post-viral thyroiditis. So we can see some changes after viral infections, such as COVID. But usually these changes do not last beyond about 3 months or so. They're very temporary. But certainly following with your pediatrician and your pediatric endocrinologist in case any of these things are of concern.
Exactly, exactly. Those are the most common causes of hypothyroidism. And we've talked a little bit about what you should watch for. So, what types of symptoms you should watch for your kids for hypothyroidism. So, we talked about that weight changes, changes with growth, fatigue, constipation, feeling cold when everyone else is comfortable. Usually, I see that sort of later on, but I do get a lot of complaints from kids about feeling cold. They can have dry skin or brittle nails is another sign, and declining school performance. So sometimes we do see that in kids who are just not making enough thyroid hormone.
Absolutely. And so, again, if you're noticing any of those things, what's the next step? It's seeing your doctor and potentially getting some blood work. Unfortunately, blood work is really the only way that we can be sure to check the thyroid levels. And so, it is very important when we talk about the thyroid. And so, there's really two numbers that we're specifically looking at when we are trying to decode if there's a problem or not. The first one is the TSH that I mentioned earlier, the thyroid stimulating hormone. Again, that is made by the pituitary gland. And the next is the level of free T4. That is the thyroid hormone produced by the thyroid gland, and it tells us what's going on in the body right now.
Yeah. And the antibodies, like we said before, are done. They can confirm Hashimoto's. They don't always require treatment. Something else I often get asked in the clinic is, hey, my child had positive antibodies and we checked the thyroid hormone labs and they're normal. Do they need treatment? And I usually will treat if the thyroid antibodies are positive and the TSH is above 10 for sure, I will treat. Okay. If that TSH number is between 5 and 10, and the antibodies are positive and the patients are symptomatic, I will often also consider treating. But if your thyroid antibodies are positive and your TSH is normal and your free T4 is normal, we often do not recommend treatment in that condition. Would you agree with that, Dr. Waldman?
Absolutely. I do exactly the same thing. And just to clarify, hypothyroidism, which means not enough thyroid hormone, the labs that we see is actually a high TSH. Your brain is saying, work thyroid, but the free T4 is either normal or low. So it's a little bit confusing when we think about the labs and we think about what it means. So again, hypothyroidism, your thyroid isn't working enough. The lab work that we see is a high TSH and a low or normal free T4.
Yeah. So I usually like to think about it. It's winter now and it's cold. And so I like to talk to my patients about having it think of it like a thermostat. So your thyroid levels are low, just like the temperature is low. What do? You turn the heat up, right? So your brain is turning that heat up, that signal up to say, make more thyroid hormone. And that's what we're seeing. We're seeing a low thyroid, just like the low temperature. And then we're looking to see what is the brain signal doing. If the brain signal is turned up, then that signals to us that yes, this child has hypothyroidism and needs treatment. So that's a very important distinction to make with hypothyroidism. And it's a little bit confusing for patients and for parents to understand what that means. So I'm glad you brought that up. Uh,
Absolutely. That's a really great way to think about it. I'd never used that analogy, but I certainly will going forward.
yes. Yeah. Let's talk about treatment options. And what do you use to treat hypothyroidism?
Absolutely. As pediatric endocrinologists, there is one treatment for hypothyroidism, and that is levothyroxine, also known as Synthroid. It's the same medication, and it's an oral medication that's given every day. It is really important that these patients, these kids, take the medication. It is really safe, and it's been around for a long time. It's identical to your body's natural thyroid hormone that your body should be making. Kids respond very quickly once we start them on treatment, usually within 1 to 2 weeks. And the dose is based on weight and age. Many times we will have to increase the dose as kids gain weight and get older, of course. And we monitor those levels with our blood work and along with history and symptoms, of course.
Yeah. And the goal for this medication is really to normalize the thyroid levels. And so sometimes it takes us a couple of tries to get it to normalize. And so we may ask for labs to be done a few times. But like Dr. Waldman said, the treatment usually is very effective. This is very safe. And this treatment, actually, the levothyroxine or Synthroid, usually it's actually one of the only medications that I know of that doesn't have side effects. So as long as we don't give too much of it, we really don't see side effects. And your brain and your body really can't tell the difference between the hormone that you make yourself and this thyroid hormone. So it's a very safe and pure product. And we give it to little babies. So as soon as they're born, we give it to them. So it's very safe to give it.
Absolutely. And there's a few tips that I like to give my patients when I do start them on this medication. The first one is consistency. So trying to take the medication at the same time of day, and whether they take it on a full stomach or empty stomach, just trying to do it consistently. Usually we like to recommend on an empty stomach, but to me, if that is just totally impossible and not practical in your schedule and means that you might miss it or it would become more of a battle, consistency is most important. So whether it's taking it when you brush your teeth in the morning or taking it when you brush your teeth at night or somewhere else during the day, that's one of the most important things. And really, you can take it with almost any other medication. The only things we recommend not to take it with is with an iron or a calcium supplement, like a multivitamin. I say just space that out, give it at a different time of day. And certainly if there's a day that, you missed your exact time, it's better to take it when you remember. And if it's been 24 hours, just start fresh and forget about it. Those are usually my tips for families.
Exactly. And usually we do like to monitor labs every 4 to 6 weeks initially. Usually I like to look at the labs that often just to make sure that we're on the right dose. And then after that, every 3 to 6 months is usually pretty reasonable. And we do look at growth pretty closely just to make sure the kids are growing well when they're on the thyroid replacement. One of the myths I hear from patients and parents is, does the thyroid hormone itself, the treatment, cause weight gain? And actually, it's the opposite. So the thyroid hormone can help metabolism and help us grow and lose some weight. But not all weight gain is related to the thyroid hormone. So that's the flip side to that is replacement of thyroid hormone is not going to lead to sudden weight loss. Weight is so multifactorial, and the thyroid is one aspect of it, but it may not lead to any significant weight loss or maybe other factors involved.
Absolutely. And it comes to all of those symptoms, right? So we mentioned earlier fatigue, constipation, weight changes. We do hope that when we start treatment that everyone will feel great and the sun will come out and everything will be wonderful. But certainly a lot of these things are multifactorial. So it doesn't mean that everyone's energy is going to be perfect. It doesn't mean weight is going to be perfect, et cetera. And that again is why we like to look at the whole child. We like to look at things holistically. Yes, the thyroid might be one problem, but is there anything else going on? And we certainly want to maintain balanced nutrition, exercise, not too much sedentary activity, screen time, et cetera, no matter what.
Yeah, exactly. And the one thing is, if you're concerned about your child's thyroid gland and you want more personalized care, please visit us at Endo Kids Concierge because we can give you more specifics on your child's health. I think the other important part of this is not to Google some of these things or seek out alternative types of therapy that are available online because they're not safe and effective for your child. So I think that's very important for you to understand that we can offer great treatment for your child. Your child will grow and thrive just fine. And this is a common condition that we treat all the time as pediatric endocrinologists. So any final words, Dr. Waldman?
No, thanks so much for having me. I look forward to talking to you about the opposite, hyperthyroidism, coming up soon.
Yes. All right. Thanks for listening. And we will talk about hyperthyroidism on one of our future episodes. All right. Take care.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.